Welcome to another episode of Disrupt. I'm HHCN editor Bob Hawley, and I'll be bringing you our conversation with American Advantage Home Care President and CEO Cleamon Moorer Jr. right after this word from our sponsors. Looking to build physician partnerships and increase home health referrals? How about expanding in new locations through mergers and acquisitions? HomeCare Homebase helps growing agencies of all sizes streamline processes and enhance interoperability with a flexible blueprint for long-term success. We'll help you attract top talent and enhance clinical care with expert tools that allow clinicians to complete required documentation in the home, not after hours. We could also tackle revenue cycle management for you, giving you more time to focus on the patients and families who need you. Grow your business with the #1 industry leader. To learn more, go to hchhb.com/growhomehealth. In this episode of Disrupt, we're talking to Cleamon Moorer Jr., who leads American Advantage Home Care, a home health and soon-to-be hospice provider located in Dearborn, Michigan. American Advantage Home Care isn't one of your big home health players today. In fact, not too long ago, its patient census was only around a dozen or so patients. But since Moorer took over, he has grown the provider several times over, still using its small but growing size to remain nimble and differentiate itself from market competitors. Well, let's get to it. All right, Cleamon. Well, thanks for joining us today for this episode of Disrupt. A lot of our listeners probably tuned into the PDGM Summit back in March and heard from you. How's everything been going since then?
Hey, Bob. Things have been coming along very well for us. We've been busy and doing our best to serve patients over here in our region.
And for those who didn't have a chance to catch you at the PDGM Summit, what is that region exactly? Can you kind of maybe tell us a little bit about American Advantage Home Care?
Certainly, Bob. Well, American Advantage Home Care is located in Dearborn, Michigan. Dearborn is about 5 minutes or less outside of Detroit, Michigan. So we serve patients in Wayne County, which is, the Detroit area, and in several others, so close to about a dozen counties, we serve patients. American Advantage Home Care was founded in 2012, December 10th. So next December will be the 10-year anniversary for American Advantage. We have several drop site offices around Metro Detroit to make it convenient for our clinicians to be able to pick up medical supplies and drop off specimens, and also to drop off paperwork, signature logs and the like. Just like most skilled home healthcare agencies, we offer all of the various therapies. We also offer, skilled nursing, medication management types of services, as well as home health aid assistance. So that's speech, physical therapy, and occupational therapy. We started out when Nicole and I acquired American Advantage in 2019, about 2 years ago. We had 13 active patients. So over the course of the last 2 years, it'll be 2 years, June 5th, 2021, we've been able to grow a little over 1,000%. So now we have a census of a little less than 200, and we're still climbing.
We first connected several months ago now, and I think I recall back, when American Advantage Home Care was first founded, it served a very specific demographic, and then you guys came in and you kind of broadened the focus a little bit, correct?
That is correct, Bob. Nestled in Dearborn, Dearborn is noted for having the largest Muslim American/Arab American population in the States. So there's about 100,000 residents in Dearborn, but we know that the big D is Detroit, and Detroit has about 800 to 900,000 residents. So it was very important for us to be able to extend and expand our offerings into Detroit inner city, as well as some of the other suburbs. So we stretched about geographically as well as demographically to meet the needs of more Metro Detroiters.
And Clem, just out of curiosity, what got you interested in home health in the first place?
Oh, Bob. So let's see. I guess 7 years ago now, I was a business school dean. I had a former business graduate, a student from Chicago. I used to teach for many years at St. Xavier University over on the west side of Chicago. But anyhow, one of my former students got a master's degree in public health, took a position out in Kansas City at the University of Kansas Health System, which also has home health affiliates. And he invited me out to give a seminar on workflow and process design and motivation for that system. And in preparing my research for it, I did not realize that so many universities had home healthcare affiliates outside of their own hospital network. So that piqued my curiosity. And then my wife, Nicole, as a teen, she was a home health aide, and then later a certified nursing assistant. So she taught more about it, and I continued to take on various consulting projects, and then ended up taking a role as a business development and strategy officer for an agency here in Michigan. And the rest was history. I got a chance to look behind the curtain and see how invaluable the work is for the homebound community, and saw that, hey, the future of healthcare is in the home. So let me step up my level of engagement and really get involved in the industry.
That's awesome. I feel like every time that we talk, I learn a little bit more about American Advantage Home Care. And I guess I should start be calling you Professor Moorer these days.
Oh, man, it's still in me. It's still in my blood. Hey, Bob, I teach. I'm a visitor at Saginaw Valley State University. Saginaw is in mid-Michigan, so I do get an opportunity to teach and share with students, about business as well as about, healthcare and health administration. So yeah, it's still in my blood to teach, even though I'm not running business schools anymore as a dean. I feel as though I have an immediate impact on the communities by helping the patients with their health-related issues and concerns.
Well, Clem, one of the reasons why I wanted to get you on Disrupt this month was because you're constantly following the latest news and policies out of DC,
Yes.
what's cooking in the home health industry. And there's been a lot of action of late. Home health, home care have both been in the spotlight. What's your take on just all the attention that the industry is getting these days?
Bob, it's good. It is really good, the attention and focus. It's not an ancillary. It's a modality, delivering home health care to patients and their families in various communities. It's not a fad nor a trend, but it's certainly a modality that's vital to the overall ecosystem of healthcare. In view of COVID and nursing homes being ground zero a little while back, a little over a year ago, I believe a greater spotlight and attention was placed on the home as being a viable option for delivering, healthcare. So I feel real pleased to see that there is greater attention, focused on it. It's not an ancillary or a supplement or a complement, but it is a viable modality that is certainly the future of healthcare.
And when we talk about the attention being put on home health and home care, that of course includes the American Jobs Plan.
Yes.
That's something proposed by the Biden administration that would send $400 billion to home and community-based services in the U.S. I know it's still really, really early. We don't know all the details yet. We don't even know if the American Jobs Plan could become a reality yet.
Mm-hmm.
But what would something like that mean for, not even just providers at this point? What would it mean for aging in place in this country?
Yeah. So if we're able to get this done, if the administration is able to get hopefully a bipartisan, deal in place, Bob, to push for it, to really answer your question, whenever I think about PESTO, and I use the acronym PESTO for politics, economics, society, technology, the environment as we know it, and legal, the legal environment. When I think about those PESTO factors and really hone in on the jobs and the type of jobs and how we're going to use technology and what that societal shift will look like, granted that by 2030, the boomers, the gray generation, the originals, if you will be the largest, right? The largest segment. And then aging in place, you're not going to displace the largest segment. The segment that's outpacing the 1 to 5 year olds is going to command a lot of our attention and jobs dedicated to serving them, whether it be technological jobs like app development or definitely medical and health jobs. It's going to be a big time game changer. And I would, if I had an opportunity to share with Biden's team some must haves in that plan, I would really hone in on the workforce, being a top priority. Like, how do we start to not only look at the CNA track or the LPN or the LVN track into nursing, or the CODA track into occupational therapy, or PTA into physical therapy, but I would really have a serious conversation at the community college level about home healthcare concentrations and home healthcare degree tracks that are a little medical oriented and then non-medical oriented in terms of getting students to an associate degree. Definitely looking at, HIPAA compliance and our apps. How do we create an ecosystem of apps that sit on phones to allow caregivers and patients and family members to have a snapshot of what's going on in the continuum of home health care for their loved one. I would add, Bob, to that big game changer. If aging in place is the mantra of the future, let's get our homes senior friendly. With fall prevention, generators, do we get subsidies and reimbursements for generators and access ramps? Child care credits, continued child care credits. Granted that some of the home health care professionals tend to be at the lower end of the wage rate and debate. There's going to, be much more assistance needed with child care. And then lastly, Bob, as a game changer, I believe we're going to see more public and private partnerships, not just through insurance or Medicare Advantage programs and the like, but we're going to see a lot more of the non-governmental organizations and the not-for-profit step up in view of access to food and transportation and some of those social services. So I anticipate a tremendously large game changer if we're able to get this bill passed, Bob.
The common thread there in your last response was staffing, and how finding the right people could be a challenge, how keeping the right people could be a challenge. That's something that lots of our providers have talked to Home Healthcare News about. What's American Advantage Home Care doing to recruit and retain all of your valuable employees?
Well, Bob, we've implemented, even being a smaller group, right? Being a smaller agency with a census of a little under 200, we had various benchmarks in place for when and how to adopt benefits, when and how to adopt benefit plans that are PPOs to be able to help and support families so that they don't have to worry about, do I jump on the ACA exchange? Do I have to apply for Medicaid? And I'm in the business of providing care. So we really identified some good small business plans out there to make medical benefits available. We also looked at employee assistance programs. So we've adopted an EAP to be able to help our employees sort through some of the challenges that they may have. Some of those challenges could be related to buying a house, right? Dealing with depression and anxiety, work-life balance, savings, personal finance. So we saw, hey, we need an EAP that is 24/7, multifaceted, that can help and assist our employees, as well as a solid PPO medical benefits plan. And then lastly, I would have to add, Bob, that we really focus more on culture. How do we create a fun learning environment where people can take joy and take pride in the work that they're doing, learn as they grow, and then set in some benchmarks, some benchmarks for pay by performance, for increasing the visit rate for various clinicians whenever they work weekends and after hours. So some tangible and intangible perks have been of great assistance to us, Bob, in attracting new talent and then maintaining our talented workforce.
And, a couple of minutes ago, you mentioned how American Advantage Home Care grew by 1,000% over the past couple of years. To do that, I imagine you've had to grow your staff quite a bit.
You get it. You get it and you got it, Bob. And that's it. So I think and this is taboo for a lot of folks as they begin to think about profit margins, right? And say, if I increase the wages, if I throw in all of these insurance benefits, how am I going to grow, right? And I think the notion is if I don't grow our census and if we don't grow our clinician base, we won't be profitable. Now, the question becomes, how profitable do you have to be? Do you really have to look at every case that you open up and say, hey, I need a 40% profit margin on this, or I need a 30% or 20 or 10. I don't believe in that, Rob. I think whatever excess you have, take it and plug it back into the organization. Plug it into your learning, your technology, plug it into your people. And in the long run, you're going to achieve profitability, and looking at what is our impact. If you're able to impact more clinicians by providing a livelihood and great work, and you're able to impact more families by providing quality care, hey, the surplus in profit, it'll be there eventually. But don't make it the focus. That would be my advice, Bob.
Just talking about your bottom line, at the PDGM Summit, you obviously talked about American Advantage Home Care's transition to the new payment model. But how has that gone? How has that continued to go this year? Because I know that there are still plenty of new things to overcome, like the shift to the no pay wrap, for example.
True. So I look at it as it's more so of a deferred payment. So if you go we went zero wrap, we went 20% wrap in 2020, which began to slow us down a little bit from a revenue standpoint. But you learn quarter to quarter. So if you go back to first quarter 2020, and then we were hit with the pandemic in March of 2020, you say, wow, so you've taken care of a patient for a 60-day cert period. You're on the verge of recertifying a patient for another 60-day cert period. And now you're getting 80% of the revenue on the back end, right? You fast forward, Bob, to here in 2021, and you say, hey, I'm going to take care of a patient for 60 days, and we won't get a payment, until March, or you're not getting a payment until, May or June, contingent upon when you started a patient in the first quarter. It's an adjustment, but I view it as a deferred payment where the quality assurance department, the schedulers, the director of nursing and the associate director of nursing, they're looking at cases and we're identifying what will be the feasible amount of visits in order to ensure that goals are met on each of those plans of care. So being a little more exact and a little more precise about how we can continue to move patients. And then for those patients where goals are minimal, what does it take to maintain? So what does it take to maintain a patient who has MS or third stage MS and has been bedbound for 15 years? How can we still continue to provide quality of care for that patient, as well as a little respite, if you will, for that caregiver in a way that's beneficial first and foremost to the family and the patient? And then how does the agency be able to cover its costs? So I think, Bob, we've just been much more precise and exact in looking at care and visit allocations.
We've reported a lot on post-acute care volume trends, and namely how home health volumes have strongly rebounded and then some compared to early on in the pandemic, while SNF volume has recovered at a far slower rate. What do you think the SNF space looks like moving forward?
Well, the SNF space is going to certainly be more transparent in terms of screening of healthcare providers on a daily basis, much more reporting in view of patients. Access is going to continue to change, and access is going to be a little more virtual to an extent where we're going to be able to have much more tele visits, of loved ones. I imagine that some of the monitors and screens in the skilled nursing facilities will have that two-way video capability to allow loved ones and friends to be able to visit, virtually. So I do see some great capabilities coming out from a technological standpoint. In terms of volume, I do believe SNFs will rebound all in all. They may rebound slower, where families may be much more cautious and selective about the home, about the facility, about that nursing home that their loved one is admitted into. But Bob, I think that they are going to rebound, but I also think that home health or the home environment will continue to surge based on it being a destination that has little to no unknown variables, whereas there's still going to be some unknown variables about nursing homes because the loved one or family member can't watch that loved one 24/7.
Mhm.
But in the comfort of home, you got your cameras, you have your telehealth, you got your Ring doorbell system, and you have so many integrated apps that home health care agencies are able to use to keep those families engaged. So it's just something about the comfort of home that's going to be hard to mitigate going forward.
I'm just thinking back to one of your previous answers too. We look at the growth of American Advantage Home Care over the years, gone from 13 patients to dozens more.
Yes.
Still, like you said, that makes you a relatively small home health organization compared to some of the behemoths out there. The
Yes.
market is consolidating. Some of the big companies are getting bigger. What's your market look like? And then, how do you compete with some of the bigger players in your area?
Yeah, so that's an excellent question, Bob. I think that as I look at the consolidation and we look at, even, Humana's full acquisition of Kindred at Home, right? And you're seeing somewhat of a trend there where payers are stepping into the space and Amazon stepping into the space. I think, Bob, for us, I'm going to hedge all of my bets on authenticity. I think with authenticity and originality, there are going to be people that want the customized approach, that want that customized, personalized approach of, hey, after hours, I know I could get in touch with the owners of the company. I know that my loved one is not one of 10,000 or one of 100,000, but my loved one, is not viewed as a number within the census, but it's a person. So I think for us, Bob, continuing to customize and personalize our care offering in a way that is authentic and heartfelt, I think we not only will we be able to survive, but we'll be able to continue to thrive as being, your local friend, your local partner in this home health care experience, for your loved ones. So I think you can't duplicate that. You even when you franchise, you cannot duplicate the authenticity and that personal connection. So we built a show. We built a biweekly podcast and webcast called the Home Healthcare Today Show, where we bring in experts and specialists from all over Detroit every 2 weeks. And we follow the healthcare calendar and we talk about issues and topics that are really important to people in the area. So I think if we just continue that, Bob, continuing to be personable and credible and accessible, we'll be able to hold our place and not get greedy, continue to focus on the growth of the quality, the growth of the kinship, will be okay. But the big players, they're going to do their thing. And I know at some point they'll knock on our door and say, hey, you guys got a special sauce, and we're interested in adding it to our portfolio. And our goal, Bob, is to remain independent for as long as we can, because we do not want to lose. We do not want to lose the connection and the relationship that we have with the people that we love. So when you got a genuine love for the streets and a genuine love for the people, you can't sell that out. You can't trust that the organization that acquires you is still going to go the extra mile the way that you do, which creates your brand. Going the extra mile of dropping off medical supplies to a patient's house, or accommodating whichever hours that are best for a caregiver within a house, where you say, hey, where a patient says, I'm the daughter-in-law and I work from 8 to 5 and I want to be trained on the pick line. So either you're going to come at 6:30 in the morning before I leave, or you're going to come at 5:30 when I get home. Us being able to accommodate that, is hard to duplicate. So we want to continue to break our back, to meet the needs of our patients and their families. No doubt about it.
So authenticity is obviously going to remain a priority for American Advantage Home Care in 2021.
Yes, sir.
What other plans do you have? What else is coming down the pike?
Growth and expansion, we got to take care of the veterans. We have a great opportunity, even in view of, bringing an end to the longest war, right? We're going to have folks that come home that are traumatized, mentally. So we want to get more into the behavioral health aspects as related to mental health as an organization. How do we deal with anxiety and depression? Let's bring a psychiatrist on board and have the psychiatrist as a key member of our home health care clinical team. Let's look at more nurses with psychology background. So really honing in on the mental health of our soldiers as they return home, as well as, some of those that are injured. So really stepping up our game in view of partnering with the Veterans Administration hospitals. So a lot of VA work, hospice work. And then the rest of the year, we're going to focus on a little growth in terms of locations. Opening up some additional drop sites in areas that are closer to hospitals, where we're getting a lot of patients who are discharged in those areas. So growth. And then we got a Joint Commission survey coming up in May of 2022. So we'll be at the end of our 3-year cycle of our current accreditation. So we'll be sharpening the knife in preparation for that survey next May. So we got a few big things going for us this year, Bob.
And then, we've touched on a lot so far, touched on PDGM, touched on the no pay wrap, touched on what makes you guys unique. What else is important to touch on before we end this episode of Disrupt? Apart from the American Jobs Plan, is there anything else going on?
Yeah, I would add, Bob, that as you think about some of those challenges and achieving goals, increasing the network where we expand the boundaries, where you expand the boundaries of home health care to, farmers markets, right? Where you expand it not only to clinics and specialists, but to your local transportation companies and all of your social service groups. So I think for those of us that are on the front line, we have to be ambassadors of the industry and identify all the different ways. I mean, even when you think about the Girl Scouts, Boy Scouts, Big Brothers, Big Sisters of America, how could some of those young people, be integrated into the home health care industry and arena? If they're reading the seniors, right? If they're crocheting with seniors, if they're doing yard work and the like. So we got great opportunity over the next decade, until we get to that 74 million in 2030, to continue to push all of the boundaries of our industry and expand our ecosystem, Bob.
All right, Cleamon, thank you so much for your time today. Can't wait to catch up later this year.
Likewise, man. We're going to do it again. I really look forward to it.
Thanks for listening to this episode of Disrupt. For more news and insights on the home health, home care, and hospice industries, subscribe to our daily or weekly newsletters at homehealthcarenews.com. I'm Bob Holly, and this has been a production of Aging Media Network.